today. And on behalf of the entire St. Elizabeth team, I would like to welcome Senator Mitch McConnell to our Fort Thomas campus and extend our gratitude for his role in the passage of the CARES Act, which has helped St. Elizabeth and especially our associates and patients through this unprecedented pandemic of COVID-19. To say the past 3 months have been monumental would be an understatement. We have experienced rapid change in processes, personal protective equipment, visitation, and social distancing. Yet one thing has remained consistent no matter the amount of change: St. Elizabeth Healthcare's focus on patient care and the commitment to the Northern Kentucky region. While most Americans were told to stay home, our team showed up at work every day to make sure our patients received the care they needed and deserved. Our senior leadership team is so proud of how our associates and physicians heroically responded to this unprecedented crisis. I would like to especially thank John Mitchell and Bernita Anderson for their daily on-site leadership at this Fort Thomas campus. I want to personally thank our infectious disease response team, as well as a team of nurses, physicians, environmental services staff, maintenance, and leaders on the front line, especially here at Fort Thomas, who saw 90% of our COVID positive patients. I have a message to the public. Healthcare is safe, especially right here at St. Elizabeth. Please don't stop seeking care out of fear. We are safe. Leadership is focused since day one. Our entire focus has been on the safety of our associates, our physicians, and you, our patients. This is where the CARES Act has been instrumental to us, and I'd like to thank Senator McConnell for leading this effort to help secure relief funding so that we can navigate through this difficult time. We were able to focus on care and not worrying about the significant losses, financial losses. To date, we have received $32 million in relief funds, coverage for uninsured patients, a delay of disproportionate share payment cuts, eligibility for FEMA funds, and advanced loan payments. I can't thank Leader McConnell enough on how quickly the relief funds were delivered. Simply game-changing. All these components helped our finances in order to allow us to keep all of our associates whole, while other systems throughout the region and the country have had to make the difficult decision to cut hours and pay, or furlough, or even cut staff during COVID-19. We look forward to the CARES Act 4 and are grateful for the Senator's inclusion of liability reform, additional relief payments, and potential loan forgiveness. Before I turn the mic over to our Chief Medical Officer, Dr. Larry Kendall, I want to thank Senator McConnell for his leadership and quick action for healthcare across the nation and especially Kentucky. Thank you.
Thank you, Garren. I want to extend my thanks to Senator McConnell as well for your assistance in helping us survive through this pandemic financially. I also want to thank my colleagues and frontline staff in caring for our patients during this time of uncertainty and your perseverance in caring for them despite long hours, your own discomfort and fears. Like always, you put our patients first, and that is what we do as healthcare workers. As a system, I am proud of all the innovative and creative ways we dealt with the pandemic. St. Elizabeth physicians, our physician group, deserve great recognition for their heroic efforts. They pivoted quickly to move to video visits, going from 50 a day up to 2,000 per day. This delivery model helped to keep staff and patients safe while creating a great experience for our patients. The CARES Act was especially helpful in mandating coverage by Medicare and other payers to cover telehealth visits, which is an idea that should be continued. St. Elizabeth also established a helpline to answer any questions that might arise about the virus. We expanded testing options at 2 respiratory clinics, and we have operationalized a 4-week drive-through testing site, which has tested over 3,000 patients in the last several weeks. Our physicians were also very active in policy development, lab test development, prevention messaging, and research. I want to personally recognize and thank Dr. Doris Savani, our infectious disease specialist, Dr. Latanya Brown-Puryear, our critical care specialist, Dr. Hart, our lab specialist, and Dr. Chai Mandapakla for the number of research opportunities that St. Elizabeth has been able to participate in, most notably being the first in the world to test the drug PUL-042 of Pomatec with CTI. We have also worked directly and closely with our most vulnerable citizens in nursing homes, developing plans to identify and test the residents, segregate them to prevent spread, and transport them to the hospital if they needed additional care. The list goes on, but my most impactful thoughts center around the incredible, unselfish teamwork from all of our system. Every part of our team stepped up to the challenge and faced this head-on without wavering. I would now like to turn the mic over to Leanne Ernst. Leanne and I have known each other for many years, and she is a hero in her role of overseeing our infectious disease response team, assuring that staff are supported in every way possible and that patients receive the most personal care possible during this time of unknowns and fear.
Thank you, Dr. Kendall. I'd also like to use this opportunity to thank Senator McConnell for recognizing the frontline nurse, physicians, and other support personnel. I've worked side by side and around the clock with our associates to care for and help our patients to recover. I am so proud to be coordinator and part of this team. This started for me with a call from Dr. Savani back in February when she said that we were going to be admitting our first COVID-19 patient to the hospital and to call in the team. The team is a multidisciplinary group, as Larry said, called the Infectious Disease Response Team that was formed back in 2014. We have been preparing for and training for an event that would involve a highly infectious disease patient, but I don't know that we ever anticipated a pandemic to this degree. The original team grew with staff from all of the St. Elizabeth campuses. Everyone came forward to respond to the need to care for our patients. Despite the unknown variables of what we were getting into, we pressed full steam ahead and had total support from the hospital to do whatever it takes for our patients, for their families, and for our staff. Every day since then, we have had at least one success, although some days those successes were harder to find. We've worked as a team. The obvious great days are ones when we can extubate a patient, obtain a life-saving drug, have a patient take a first sip of fluids in a month, or even help them to sit on the side of a bed. We've formed lifetime relationships. We've worked together. We've shared times that we will never forget. We laughed among ourselves back in early May about what day it was. Someone said, "Is it May 4th?" And I said, "No, it's May 5th." And they said again, "No, is it May 4th?" And I said, "No, it's May the 5th." And they said, "No, how did it get to be May?" They weren't asking about the date, they were asking about the month. They wanted to know, where did April go? Discharge days are especially joyful days for us. That's where we get to align the halls, and it usually involves balloons and cookies or lots of staff. Everyone's there to applaud. We cry. We celebrate the fact that patients are going home, that they came in, we took care of them, and now they're going back. For most of these families, it's the first time they've seen these patients since they've come into the hospital. So when they walk out those automatic doors and their family is there, it's just a sight that we just will never forget. And we have shared this. Working in this environment takes unusual skills and abilities to adapt. We don and doff each other. Where else can you go where you get to dress and undress your coworkers at work? But it's been an intricate part of keeping our staff safe, and we're happy to say that we have a safe environment, and it is good to come here for health care. We are safe. We've done the things that it takes to be able to take care of the patients and to keep the employees safe. There was a patient who was restless early on one night, and we just couldn't seem to keep the patient from wanting to get up and get out of bed. These are the kinds of things that we do. We reorganized our schedule in order to allow a nurse to stay with that patient for the next 20 hours, rotating in and out every 3 hours, so there was constantly someone in with this patient so that she could just sit at the bedside with the patient and talk to her and enjoy the glory of being with our patients. We're not done yet. We're determined, we have drive, we have desire and commitment to each other and to the organization, to our families, to our patients, and to each other to see this through in the same style that we've done it up to this point. We've incorporated expertise and dedication, working those long hours, days in a row, but it's been very gratifying knowing that we've been supported and that through this, we've had the opportunity to make a real difference in the lives of each other in our community. Thank you for this opportunity. Thank you for the ability to do what we've been able to do. And now I'm happy to invite Senator McConnell to share his thoughts. And once again, thank you for your assistance, sir, and for being at St. Elizabeth today.
Well, it's wonderful to be here today. This week marks the first time I've been able to make public appearances in Kentucky since mid-March. And I thought the appropriate thing to do was to go to various hospitals around the state and to thank the people who've been on the front lines. I'm reminded of the first responders who ran into the burning buildings after 2011. Remember these folks who are standing around here who took care of these patients. Back in February, we didn't know much about this disease. We weren't sure what we were dealing with. So they bravely went right into the face of this pandemic. And at that particular stage, I don't think we knew how dangerous it was, which were the most vulnerable populations. In fact, it was largely the unknown as recently as February. So these are the real heroes that you see around us and over here. And I wanted to come by and to thank all of you for what you've done. The CARES Act, which many of our folks here have referred to, was the bill that was written in my office, and we put it together and got it across the floor of the Senate in less than a week, over $2 trillion. To show you how unusual that is, a few months before that, as you recall, we were in the middle of an impeachment. That's about as partisan as it gets. So I was too proud of the Senate as well for being able to pivot from the most partisan thing you can imagine into a vote that cleared the Senate without a dissenting vote, both parties. And so what we were trying to do, obviously, given the fact that the government itself was shutting down our economy. And remember, in February, when you had your first COVID case, we had the best economy in America in 50 years. So in addition to a healthcare crisis, we created an economic crisis in order to deal with the healthcare crisis and shut down our economy, which was so extraordinary at that particular point. The question was, how do we get through this? And that's what the CARES Act was about. Not only assistance to frontline folks engaged in dealing with the patients, but also to try to help the businesses that ended up getting shut down and the employees that got laid off through this period until hopefully we could get to a better day. And I think the better day is beginning this week as not only Kentucky but other states around the country are opening up. So Garren and Larry and Leanne, thank you so very much. This hospital has also been selected to conduct a coronavirus treatment clinical trial, and the first in the country. So that is a noteworthy accomplishment for St. E's. There are three things obviously we need to do here. We need to test, we need to treat, and ultimately we need a vaccine. So these folks here that you see around me and over here are on the cutting edge of trying to get a better treatment for this disease. I also want to recognize the work of Tony Remington of Gravity Diagnostics here over in Covington, who recently processed their 100,000 COVID tests. So you have here in Northern Kentucky some examples of excellence that we're all proud of all over Kentucky. If you look at the CARES Act, beyond the healthcare space, there were other ways in which we were trying to help the country through this hiatus that was going to occur. $43 million went to CVG over at the airport. $8 million for Northern Kentucky University. $1.8 million for Gateway Community and Technical College, and $1.7 million for housing programs across Northern Kentucky. Shifting to the economy, as of the moment, there are 45,000 of the PPP loans to small businesses in our state. 45,000. That's about $5 billion that came in that program alone. Overall, the CARES Act has put about $11 billion into our state. The governor recently also received about $100 million for testing. So let me put away my notes and share my thoughts with you about the way forward. We obviously have an economic crisis on top of a health crisis. The government, as a result of the CARES Act and a couple of other bills we passed, has added about $3 trillion with a T, dollars to the national debt. We now have a debt as big as our economy, which hasn't happened in our wonderful country since World War II. So what I've said is we need to push the pause button here and think through the next step and do it very carefully, because we do have the potential to jeopardize the long-term health of the country with this level of massive debt. Our friends over in the House of Representatives, as you may have seen about a week ago, passed a $3 trillion additional bill, and with all due respect to them, that's not a serious effort to deal with where we are. It would in effect double the impact on the national debt from what we've already done over the last couple of weeks. So let me, a couple of months. So let me tell you what will happen if it happens. If there's another bill, and there may well be, it will be written in the Senate. It'll be supported by the administration. And obviously we'll be talking to our Democratic friends about what ought to be in it. It will not be $3 trillion. So we'll be discussing the issue of how much and the issue of when. There are other things that need to be done that don't have a direct impact on the debt. One of which I think would be extremely significant for St. E's, for any other hospital, for physicians, for nurses, for small businesses, for universities that are going to have to bravely open up this fall, and that is liability protection for incidences arising out of this disease. There will not be a bill that passes the Senate that does not have in it liability protections. Now that will not protect someone from gross negligence or intentional misconduct, but we were dealing here with a unique issue that no one understood. In February, we know more about it now than we did then, but this liability protection is going to be the key to our recovery, to being able to safely go about your business without an avalanche of lawsuits waiting to descend on you. 1,100 have already been filed. So I can tell you for sure that any bill that passes the Senate will have that in it. There may be additional assistance needed for small businesses, for healthcare. But we're going to carefully craft this about a month from now after looking at the impact of beginning to open up the economy as well, because ultimately we can't prop up the country forever. We've already got a massive debt we've created in trying to just fill this space on an interim basis. But we're going to see what kind of progress we've made in re-engaging in the economy. What kind of growth can we get back after hitting this trough, and the trough will probably come in the month of June. Clearly, we need to help those who are still unemployed. But one mistake I think we made in the previous bill will not be in the next one. We ended up paying people more not to work than to work. And that was a mistake. Unemployment insurance is extremely important, but it's not designed to encourage you to stay home. It's designed to get you through a trough until you get back to work. So I think it's likely, I think you can certainly assume that we'll not be paying people a bonus for staying home in another bill. So let me sum it up. We're taking a careful look at a fourth and final bill. You could anticipate the decision being made on whether to go forward in about a month, and it will be narrowly crafted, designed to help us where we are a month from now, not where we were 3 months ago. And so I think that's the way forward. And I want to conclude by thanking again all the people around me for their extraordinary work. It's truly amazing. St. E's is an incredible place, and it's an honor to be here today and to be in the presence of these healthcare heroes that we have all standing around here. With that, I'd be happy to take a few questions if there are any.
Good morning, Senator McConnell. James Pilcher, Local 12 News. You discussed the stimulus bill potential. Are there any other priorities in there?
Would you take your mask off, please?
You discussed your priorities. Are there any other priorities for you for potential for stimulus?
Let's look forward. Yeah, a good question. I think the two most important things to getting back to normal are jobs and kids. We got to have these K through 12 open. We got to have colleges open this fall. The country is simply going to go nuts if the kids are not back in school come August or September. Fortunately, the universities are responding to that. You've noticed the various announcements about reconstructing the fall semester to maybe end in Thanksgiving in case there is a resurgence of COVID-19. They've talked about the importance of social distancing, about wearing masks. And I think we want to underscore to young people, even though we now know more about this disease than we did in February, we also know if you're young, it's probably not going to be fatal. And but you can be a carrier. So I think you're going to see people wearing, even young people wearing masks, social distancing. Maybe they'll have to do shifts because of too many people in a classroom on a given day. But looking forward, I think the two most important things are kids back in school and jobs coming back.
As a follow to that, there's been some discussion about providing assistance to local governments. What are your thoughts on that and a potential fourth round of stimulus?
Well, it's possible. We've already sent $150 billion to state and local government. $150 billion already. And I know that state and local governments would love to have more, and it's certainly worth considering, but it is also not true that we haven't spent a lot of money already down to state and local government. But we'll take a look at that.
Last question, any reaction to the ongoing violence in your hometown of Louisville and Minneapolis, given what's going on?
These events, which the facts surrounding them are pretty obvious, are absolutely horrendous, and you can understand the outrage in reaction to witnessing events like this. They need to be thoroughly investigated, and if prosecution is appropriate, and it sure sounds looking at both these cases like that would be the case, justice needs to be done. I've always been a supporter of demonstrations, but they need to be peaceful. And this senseless violence in reaction to this is not helpful to anyone, and I hope it will stop.
Good morning, Senator McConnell. Stuart Headley, the Cincinnati Enquirer. I was just wondering, along the same lines of the last question that was asked, if you could comment on the president's tweets about the situation in Minnesota last night, primarily those where he said, quote, where the looting starts, the shooting starts.
Say that again, I was having a hard time hearing you.
Sorry about that. I was wondering if you could comment on the president's tweets about the situation in Minnesota last night, primarily those where he said, quote, when the looting starts, the shooting starts.
Yeah, I generally don't comment on the president's tweets. I can speak for myself. I think what's happening in Louisville and in Minneapolis really needs to stop. It's senseless violence in reaction to this is not helpful, but you can certainly understand the outrage. I mean, you can certainly understand the outrage, but it's not made better by engaging in random acts of violence.
I'll just follow up on that. Brian Hamrick with WLWT here in Cincinnati. I'll just follow up on that while we're on that subject. What do you think can be done to satisfy or to speak to this outrage that people have?
Well, you know, we have a way of dealing with crime in this country. It's called prosecution and conviction. Everybody's entitled to the protections of the court system, even people who apparently, if you see what happened, look pretty darn guilty, but they're still entitled to the protections of the Constitution in criminal trials. But prosecution, and if the facts warranted, conviction is the way we deal with this in this country. And look, the demonstrations are fine too, but they need to be peaceful. It does not contribute a thing to engage in random acts of violence in reaction to a hideous crime that has occurred.
I wanted to follow up on your jobs. You're talking about jobs being very important. What can happen? What can you do? What can happen in Congress to really help this job situation as you look going forward?
Well, the single biggest thing is for the economy to get back up and running. You know, the notion that keeping everybody at home was consequence-free is not true. Spouse abuse is up, suicides are up, child abuse is up. There are healthcare consequences to being cooped up at home. So we need to get out of the house, and all across America this very week we're beginning to re-engage. And that we hope will begin to lift our economy, and how much the economy's lifted will help instruct us on how much we ought to do additionally, which is why I think about a month from now is the best time to take a snapshot of how we're doing and see what kind of reaction further might be done at the federal level.
And we're also talking about keeping a close eye on these numbers of corona and COVID as it comes through.
Yeah, but I think fortunately it looks like we've bent the curve almost everywhere, and that's why governors are reopening states almost everywhere, and even New York, the hottest spot in the country, I think has had some loosening of restrictions. So let's see how much that lifts us out of this economic trough we're in.
And I just had one quick thing about the liability. when you talk about the liability, what exactly can be done in terms of dealing with the liability for hospitals and that?
Well, it would be a narrowly crafted provision related to the coronavirus that would kick in December of 19 and go until 2024. So we would not be rewriting the tort law of every state in America. This would be a narrowly crafted liability protection for this disease. Because remember, we didn't know what to do about it. I mean, we were learning, we're still learning as we go along. And so it is a big concern of hospitals, doctors, business people, others, university presidents who are opening up again, big concern of all of these people, and a big step we can take in the direction of getting us back to normal that wouldn't cost the federal government any money. Anyone else? Okay, thanks a lot.